Welcome back to Gentle Dental. I am Dr. Sarah Chinnery, and today we are going to chat a little bit about kids' dental health. In the last video, I asked for questions, and my friend Ashton asked a little bit about what to expect for kids, what to ask the dentist, and we're just going to chat a little bit about all that. Okay, so let's get into it. Let's talk about toothbrushes. So toothbrushes, you want extra soft or soft in general. You don't want anything super hard. Their teeth are small and it can be pretty sensitive for them. So just making sure that you're getting an extra soft or soft toothbrush for them. If you can, a lot of the time kids love electric toothbrushes. You can get ones that are like battery powered and they can make sounds and songs and give you that timer, which is really important to get those 2 minutes. Obviously, if you have less teeth in the 20, it won't take as long, but the goal whenever we have those 20 baby teeth is to get 2 minutes each floss. So floss is very tricky when you have a little wiggly one, but it's really whatever it works in your hands. So the second that the baby tooth is touching another tooth, that's when we have to start flossing. And if you want to start practicing before that, then, some kids actually, they have so much space that, they don't ever touch, but just for like general practice, making sure that once those teeth start touching, they need to start flossing because our toothbrushes can't get to that area. Floss picks might be a good route if you have a really wiggly one. One helpful thing is actually if your kid is mobile and does not like their teeth brushed, you're sitting down and your legs are spread out and you actually put your kid's head right at the base and then you put your kid's arms around your legs so that they can't move. And that can be a very safe way to get your kids' teeth brushed without having any issues. Next thing, toothpaste. Until age 3, we want a smear or rice size toothpaste amount. And if you're over 3, a pea size is fine. At that point, we feel like the kids are old enough to be able to spit out most of it. And that's when we graduate to the pea size. With that said, toothpaste, you can look into any kid's toothpaste that you want that has fluoride in it. The other option would be, if you're not interested in using fluoride, look into nanohydroxyapatite. That can be another option if you are not wanting to use fluoride. We'll just generally go through typically around 6 months is when you get your first teeth. So questions to ask your dentist. When are you expecting the next set of teeth? Do you have the amount of teeth that you're supposed to? When do we want to see you? Usually around the first year mark. That's just mainly to get accustomed to seeing the dentist. It's not really to do a lot. Usually we just sit them down, we'll do a lap exam. So mom or dad will be sitting in the chair with their knees towards the dentist, and then the dentist and you will be touching knees, and then you will lay your kid's head into the dentist's lap. A lot of times they'll have the board to kind of cross between the legs, and that is helpful just so that the kid is probably going to scream, and that honestly is usually great because that means we can see their mouth. So just know that if you have questions on what to expect before you get there, feel free to call so that you know what to do. A lot of the times they'll try and brush their teeth if they're really young. Otherwise, they'll try and use the Profi cup. It just depends on how the visit is going. And just know that all of things are okay. All the ranges are fine. Another question to ask is, they're little. If you're having trouble nursing, do they have a tongue tie, lip tie, all those things that can help affect that. A lot of pediatric dentists will do the tongue tie removal if needed, but that will be between them and the lactation consultant and pediatrician, all that. Other questions, if they have the beginnings of cavities, can they use anything before they go straight to treatment if they're really little? So there's a product, it's called SDF, silver diamond fluoride, and basically what we do is paint it on the tooth. It does turn the area that has a cavity black, but it stops the cavity from growing until the kid is old enough to get treatment. So if they're really little and they don't want to do sedation, or if that's just the one area, there's no other areas to be concerned of. Obviously, if it's a front tooth, it's an aesthetic problem, but for the back teeth, a lot of the times you don't even notice anything. I just like to pre-warn everyone that it will turn black if there's a cavity in it. Other questions asked the dentist: when are they getting x-rays? So typically, if they're high cavity risk and they'll let us, we can try and take an x-ray probably around age 3. And typically whenever, again, those teeth are touching, is in the back especially, is when we start taking those bite wings. I love taking a PANA, which is the big all around x-ray, around age 6, whenever we get our first adult molars, just to make sure we can see how many teeth are in our head, make sure everything in place is okay, and just counting and making sure all of the things are good. But if not, then we'll send you to orthodontist early. Braces, when do we send to braces? It totally depends. Lots and lots of different reasons, but the good news is there's lots of options and lots of time for that. If your kid is grinding or snoring, please go to the dentist. If not, your pediatrician. And if your pediatrician doesn't find that bothersome, then definitely go to the dentist. They have found in newer studies that that is actually linked to like sleep apnea, airway issues. So that's the main thing, is airway. Our bodies are not designed to grind and clench or snore. So if we are doing either of those things as a kid, that is most likely a problem with the airway. So make sure that you go see, either the dentist will refer you to the ENT or the pediatrician will refer you to the ENT. But no matter what, that is not normal. So making sure that it's our body's way of basically wanking, like the grinding is wanking us up so that we can breathe. I don't know how common that is for people to link those together, but that's a newer thing. And so just make sure that you please go see your doctor. But that is just a very quick thing, making sure that you're visiting the dentist every 6 months. And I hope that this helped a little bit to give you kind of a small update on kids' dental health. So I hope you have a great day, and we'll chat soon.